Hey, lovely ladies. What are your wonderful names, doctors?
So I'm Dr. Khulud, and I work as the head clinical standards and guidelines in Dubai Health Authority.
Wow.
I'm a physician in background. I'm a consultant in family medicine and an AI ethical assessor. Actually, the first certified in the Middle East and Africa, and I'm very proud and humbled to say that.
Wow.
My name is Hala Abu Zaid. I'm a doctor, but my specialty is critical care or intensive care. So I look after
That's
multiple hospitals in the UAE in the eastern part, and I run those departments that deal with this specific specialty. I'm originally from Sudan, so Uganda to me is our next door neighbor.
Women in medicine and international women. What's your highlight about today's conference?
It's actually women, definitely empowering women and increasing awareness when it comes to illnesses, when it comes to preventive medicine, when it comes to future medicine. So this is my area of interest, and I feel like women should be empowered even further to hold leadership positions, to be able to speak up, to be able to um, um, prevent illnesses and train and educate the future of Uganda or the future children of Uganda as well.
So this conference is an interesting journey. We were not very privileged into starting it ever since it started in 2009 with the leadership of Dr. Nelly Boma. But later on, we joined it in the subsequent years. Um, the idea of the conference is to really capacity build people by transferring knowledge around our African countries. And I think it is just um, maintaining this notion. But if we see about the conference when it started and the faculty and the members who were adding the value within the conference, and today people are increasing. So we managed to improvise, we managed to um, attract people, and the idea is now spreading. But it's not about women only. It's about empowering women and
To
younger
empower
colleagues
everyone.
and to empower everyone. I think the future of health is in women. And we are inviting our colleagues who are men to come and join us in our journey.
In our notion.
Absolutely.
Yes. Educate a girl child and you educate a nation. Educate a boy child apparently and educate an individual. Doctor, what do you think is the future of AI in medicine? You had a lot of threats and sort of suppositions that AI is going to reduce the jobs of human beings. What do you think about AI in medicine and telemedicine in general?
Everybody thinks that whenever we bring the notion of AI, people think where
Replacing human
jobs
beings
are
with tech.
taken. Yeah.
Yes.
But it's an evolution of healthcare rather than a revolution when it comes to AI because there is a change and shift in our roles as healthcare professionals. There's a change and shift in our roles as patients receiving care as well. So with AI, there has to be some ethical components for us not to have that threat of it overtaking us in terms of medical, because we're dealing with something very sensitive. We're dealing with something that requires safety, but requires patients' involvement. So in this case, we work a lot on human oversight. So whenever there is an AI component, we have to ensure that there's a human oversight to ensure that there is safety element and trust. We need not to forget that AI could not provide critical thinking or lateral thinking that human can do, and there isn't the creativity that human can provide. So AI would never take over, but it would complement. So a doctor with AI would definitely override a doctor that
They
doesn't know
can do
anything about
more
AI.
as an individual as opposed to splitting themselves apart to take
Yeah.
on different
So
roles.
the
They
whole
take
role,
on
yeah, it's to save time, basically. Summarizing, saving time with AI, for sure.
perfect. Get to do more with tech.
Yeah.
What do you think about telemedicine and reaching marginalized communities?
Well, I'm involved with the telemedicine program in the UAE, and we launched the first governmental telemedicine platform just before COVID which help us to reach out for people and save lives, because there was time where people were not able to reach the physicians. The goal down the line is to open and telemedicine across borders so that we can provide telehealth to people that require it, that cannot reach health in wherever they live. And my goal down the line is to see this beyond borders all over the world, reaching out to people that are in need and experts around the world so we can get advice where we are at the comfort of our homes.
Doctor, what do you think about women occupying more than just one field in medicine?
Well, I think they proved themselves. They did very well. Still, there is a huge gap to fill. We are still conscious of equality and equity in health.
And how far we can go?
Well, I think we can go up to the sky. The sky should be our limit. And I think unless we identify the gaps, I think we cannot plan. But of how I look into how women went ahead ever since the feminist revolutions amongst feminists or women in general, where women were just domestic workers or family people producing kids, staying at home, not getting educated, being underprivileged. Now we can see a lot of transformation. Women are now forming most of the consumer market. Women are now amongst leading people in positions, people like governing societies or policymakers or heads of states. I'm sure I was very encouraged when I saw your health ministry made up of all women. And if I
The
quote
executives
other,
are women.
absolutely, examples around us in Africa, like Rwanda, most of the parliament are women, and a lot of other examples. So I think women amongst professionals, the graph is going up, the trajectory is certainly encouraging, but there are so many gaps to fill. But unless we understand those gaps, we cannot fill. One of the things that we can fill the gaps with is this type of conference, how we capacity build, how we transform this by education and training and networking and lifting up one another. We have still lots of threats and lots of opportunities, but I would like to look at threats or opportunities to be just notions to make us look for answers, and we
More
together
than
can
a threat or
absolutely,
something to get us
absolutely. They are
locked
just
in.
challenges, and we can overcome them. We overcome a lot as women, but in solidarity, we can have a better impact. And I can see Africa doing a great deal when it comes now to bridging those gaps. Things were not quite as bright about 50
By
years
your
ago,
time.
but now things are moving ahead. Maybe in the next generation, we will see things improving quite a bit. But I think we have got still some stuff to do.
A lot of
We are
work to
committed,
do.
absolutely.
We can never know how much activism is enough and effective towards bringing out women from marginalized communities and extremist communities where they're told how much they can be, how far they can be. It's like you can be this free to this much you can do as long as you don't do this much.
You know,
We can be activists,
absolutely.
we can have awareness, but how can we do that effectively to see that
Well,
change?
absolutely, I agree with you, but I think
Much more than being a whistleblower to make the
absolutely,
issue known.
absolutely. But I think I can relate to that one way or another, because Africa in general, when I look at it, and I come from the continent, I look at people who were in marginalized communities, people who were living in it about thousands of years ago. We still remember the role of the grandmother in stabilizing houses or homes. We still remember the traditional healer who was a woman to guide the community into health and stuff. So I think the role of women was already there. But I think now, as we see the roles should change, it is just to adapt to the changes around us as well, not to be backwards for women, not to lag behind. So I think there is a lot women can do. They already done it, but we just need to tune it to reach our objective. And as I said, the sky should be our limit. And I think if you build a woman, you build a nation. Simple.
Thank you. You build women, you build the nation. Thank you so much, doctors, for your time.
Pleasure. Thank you for
your
having us.
insight.
Thank you
Thank you
for
very
having
much.
us.
Coming to be among great women.
Thank you
Thank
very
you
much.
very
And
much.
thank you,
It's our
Uganda,
pleasure.
for having us.
Thank
You're
All
you,
the best.
Uganda.
welcome. We are Uganda Medical Association.
Great.
Yeah,
All the
yeah.
best.
Thank you.
Hi, ladies.
Hi.
How are you? We are getting a Ugandan's perspective on today. Hi, ladies. How are you?
We are fine. How are you?
How's this warm, sunny afternoon in Kampala?
The weather is beautiful.
How do you like the Ugandan weather? We're going to have a Ugandan's perspective on today's conference, and we're going to be graced with
Dr. Salma?
Dr. Salma's opinion on today's conference.
Yeah.
Homebred versus international. They're going to tell us.
Really?
What do you think about today's conference?
What I think about today, I'm Namtevi Jacqueline, and today was really very, very beautiful.
What was
The ladies
beautiful day?
that day was really, 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 really good because the ladies gave in submissions that cut across sexually transmitted diseases, HIV, the way women are suffering due to disasters, and we need more support, more funding. Women have a high vulnerability. They are suffering a lot, and we should end the wars, the anger, everything, because it affects women more. Every day, everywhere in Africa, women are suffering the preventable things. And if we come together, all of us, we can bring happiness to women's lives and their children, men and boys. Yes.
Dr. Salma, what's your take home from today's event? Very wonderful presentation, by the way.
I think it was a very successful event.
Mm.
I think we got to learn a lot.
Mm.
We are here to exchange knowledge, and I think that was very successful.
Mm.
The talks were all very relevant. The
Mm.
input we had from the people of Uganda was also very, very relevant and very insightful.
Mm.
And I think if it wasn't for this event, I don't think I would have visited. I would have
This country.
Yes,
Wow.
exactly. So this platform really encourages us to basically network and learn from others in countries that we wouldn't have considered in our list otherwise. Yeah.
What does it feel like being part of something bigger than yourself, a legacy that you're going to leave past yourself? Personally, I feel like being a medical doctor is serving in a capacity, something that is not just about me and a job description, a title, a salary, a pay, vacations. It's more than just me. It's the lives you touch, the impact, the change. What does it feel like being part of something bigger than you?
Well, I feel humbled and honored to have this opportunity. I think I did not choose to be here, but I think it's a calling.
Wow.
You know, and I just wake up every day very humbled that I'm able to do this, and to do this in my own capacity is something already humbling. But to be able to go around and meet other people who do the same thing, that's even more rewarding.
Any advice for women that want to join the field,
Yeah,
regardless of war, regardless of vulnerability, regardless of any challenge?
had a talk today by one of my colleagues,
Mm.
and there is a tremendous growth in women joining healthcare, but it's still not enough. So there's always space for growth. There's always space in healthcare. We're always lacking when it comes to healthcare in terms of manpower. So I would always encourage anybody, especially women, to take this path. So if you're hesitating to come into the healthcare, to enter the healthcare community, please don't. It's very rewarding, and you're needed. We're definitely needed.
What would you say about the stereotypes or notions that women might be great multitaskers but rarely the best at mastering a thing and becoming the greatest in a thing, especially for medical disciplines and fields that are male dominated?
I
Like
totally
a
disagree
woman
with
doing
it.
orthopedic surgery, they'd call that a lady in a man's field. A woman doing
You know what? This is where I'll say had a really good talk today about that as well. Um, we're damned if we do, and we're damned if we don't.
Yes.
You know, so if it's orthopedic surgeon, they would say, "Oh, you're too masculine."
Exactly.
If
You be labeled.
you're going to be labeled either too masculine or too feminine for a job, and I think we should move past that, and we should try to disintegrate from the labels and basically focus on the goal of just basically providing healthcare to those who need it. You know, and just let go of the titles. We have no. I think there is no space to have such discussions when we can have much more productive discussions
Yes.
on how to get the services into the field
To those who need
to
them.
those who need it, regardless of whether it's too feminine or too masculine. I think we're past that.
We have passed that. Actually,
Yes.
Dr. Salma, what men can do, also women can do, and women can do it better. Because even in the health system, you've seen women, we are more approachable, we are more kinder, we are more available, we are more there for patients. That means we can do actually better. Women should stop being, I can't be a nurse, I should stop in senior 4, I should stop at low age. I belong to the kitchen. You don't belong there. Women
You're
don't
more than
belong.
that.
We are more than that. If men can do PhDs, they can be doctors. Even women can be doctors.
Anything
They
they
can
want
be
to be.
anything they want to be. If a man can ride a car, a big car, even a woman can ride it. Even in the healthy system, it should be there. Even in other job markets.
Yeah, I think
Thank you so
right
much.
now it stops being about it should stop being about a competition so that if there is a need, anyone who can fill that need and offer the services regardless of what gender role we play,
Yes.
we should go forward and do it.
Excellent. Women are so many things. They wear so many hats, from being primary caregivers at home to being so many things. What do you think about having to play so many roles and at the same time having to work in a system where they are vulnerable and should have as much capacity as the ones that are not vulnerable? From marginalized to getting low pay, from sexual harassment in different jobs, from
I think we shouldn't stop talking about it and we shouldn't stop discussing it and trying to move forward. Uh, I think the focus should be again, as I said, offer your expertise and your services wherever it's needed and when you can. I don't think anything is a limiting factor, whether you're a primary giver at home or a healthcare worker at work. I think those are just roles, and as you said, we wear many hats, and we can do all that.
how much activism is enough towards eliminating the things that make women vulnerable in the medical field and in the healthcare system?
I think support, as long as we support each other, we will
Eliminate.
silence a lot of these negative ideas that are holding us back.
Okay.
You know,
Actually.
I totally believe in leading by example.
Perfect. Excellent talk, ladies. Nurse Jacqueline and Dr. Salma, it was nice having you here today. We remain Uganda Medical Association TV. Thank you so much, ladies. Thank you for your time.